Am I in?
Yes, you are in, Prof. Good afternoon.
Good afternoon. Let me see.
Yeah, I can see you.
I
Can you see me?
There's something showing something that's blocking your face. Let me see.
Oh.
Okay.
Well,
so I need to go down.
okay. You want to go off and come back in?
No, I mean height.
Okay. Well, we can see your face, but we cannot see your hair properly. Yes, better.
Okay.
Yes.
And what about the lighting?
It's all right. We can see you. It's clear.
It's clear. Okay.
Yeah, very clear.
All right. Good
So,
afternoon.
good afternoon, Prof. Nice meeting you. Nice seeing you.
Yeah, nice seeing you as well. Nice meeting you.
Yes.
Looking forward to.
Yeah. So the interview. And how is your Sunday going?
Very, very well, thank you. Yeah.
Yes.
So you're happy with the lighting because I can make it brighter.
No, but if you want to make it brighter, why not?
Yeah, let's see.
Why not? Welcome, Oluwafemi. Welcome, Miss Tanik. Welcome, Oasis Creations. AB, nice to see all of you. Welcome, welcome, welcome. So we'll start on the dot of 3. So it's almost 3 o'clock. We have just 1 more minute to 3. So we now start asking our prof all the questions concerning women and health. Doc, I see you have a gap tooth just like me.
Yes, that's correct.
Okay. What state are you from in Nigeria?
Ogun State.
Ogun State. Okay. Where in Ogun State?
Ijebu Igbo stroke Ijebu Ode.
Okay. So are you a member of the is it Heritage Club in Ijebu Ode?
I don't think so. Is that a UK-based organization?
No. Well, I don't know if they have a branch in the UK, but I mean in Lagos, and sorry, in Ijebu, they have that group. You know?
Maybe because
well-meaning. Yeah.
Maybe because I'm not resident, I may not have been invited.
Okay. Or maybe you should think of starting one in the UK, if your time permits.
Ogun State has, some people have started an Ogun State, what's it called? Association or something to that effect.
Okay.
Yeah.
Okay. All right. Tony, welcome. Tony, my dear Tony, thanks for everything you've done for me. Thank you so much, Tony. That's Dr. Ajala. And thank you, Ade Lekuda. Green Springs for joining. Thank you very much. So it's 3:01, so we'll start now. Prof, so thank you for agreeing to be interviewed. And you're welcome to Adonis Parlor.
Lovely. Thank you. Good afternoon. Thank you for the kind invitation.
Thank you. Thank you, Prof. So Adonis Parlor is all about focusing on the diasporan who is inspiring lives, who is motivating lives, and also giving back to society, you know. And this is what we do in Adonis Parlor. And every week we make sure that we interview, you know, someone who is, you know, doing the things that I mentioned, you know. So, Prof, I know that you are very big in the medical field here in the UK, and I thank you for finding time out of your very busy schedule to come on to Adonis Parlor. And of course, you are going to talk to us about health issues concerning women. So, Doc, please, can you tell us, sorry, Prof, please, can you tell us about yourself? Introduce yourself.
Whether you call me Mr. Doc or Prof, it doesn't matter, or Rotimi, anyone goes.
Okay.
So I'm Rotimi Jaiyesimi, proudly Nigerian. I'm currently Group Associate Medical Director for Patient Safety in one of the NHS hospitals. As well as that, an obstetrician and gynecologist. I schooled in Nigeria, primary school, Mrs. F. Kuti's class in Abeokuta in the 60s. Then went to Ibadan UMC demonstration school where I completed my primary school. Then went on to Government College Ibadan between 1966 and 72. After which I went into medical school, 73 to 1978. And I've been in the UK or the British Isles since 1985.
Oh, wow. Oh, wow. Wow. That's amazing. So when you were in primary school, that was about the time when I was born. So
I'm a young
yeah.
man.
Yes, you look young,
I'm
Prof.
a young man.
You are. You even look younger than the pictures.
Thank you.
You look younger than the pictures, and your hair is not so gray. You just have dots of gray. So
Well, thanks a lot.
yes, you're welcome, Prof. Yeah. So
Yes.
Prof, so why did you decide to go to study medicine?
I think Government College Ibadan was predominantly a science school.
Okay.
Mathematics, biology, chemistry, physics for A levels. And there wasn't much emphasis on the arts in those days in Government College. So that limited my choice as to what I was going to do. But in addition to that is the fact that my mother was a nurse in Abeokuta, Benin, Ibadan, UCH, Adeoyo. And I think visiting her in the hospital probably influenced myself going into medicine. And I also had uncles who were in medicine. My senior brother, Freddie, who retired 2 days ago, is also a doctor. So I think it was just naturally. And you don't go into medicine because people go into medicine. I think there are other personal virtues that you've got to have. You've got to be compassionate and be empathic.
Yes.
Whether I had those virtues then, I don't know. But only my patients can talk about that.
That's one valid point you just made. For you to be in the medical field, working on the field, as a nurse or a doctor, you have to be empathic and, compassionate. But then that's another story for our doctors. I mean, our nurses back in the government hospitals in Nigeria. That's a different ball game, But that is what it's all about, being compassionate and being, empathic. So, doctor, so why did you decide to? Sorry, Prof.
Call
So
me anything, Rotimi.
okay.
Let's make it casual. It's
So
Sunday
are you
afternoon.
Rotimi?
Call me Rotimi. I'm happy with that.
Okay, no problem. All right. So, Prof, why did you decide to specialize in obstetrics and gynecology?
Yeah. I think during medical school, it was one of the subjects that I found fascinating.
Okay.
Apart from the fact that you brought joy to people when a baby is born, that's a new life. Everybody's happy. In gynecology, you're trying to help people to fall pregnant, to get a baby. People with abnormal periods, you're also trying to help them rectify their periods. And you rarely find people dying in obstetrics and gynecology.
Oh, okay.
And during my training, I think going through medicine, surgery, and other specialties, I could see the pain people with chronic illnesses and people with cancer underwent. That may have influenced me as well. But I think also the family history. I had an uncle who was a pediatrician, and I thought, no, my uncle's there already. He's occupying that space. My senior brother was in medicine, and I said, well, he's occupying that space. And so I had two choices, obs and gynae, obstetrics and gynecology, or surgery. I love surgery, but I did neurosurgery as
Okay.
a house officer. And standing for 7 hours operating in the brain
Wow.
probably put me off neurosurgery or surgery. But I think I just naturally went into obstetrics and gynecology because I loved it.
Okay. Okay. That's a nice reason. That's a good reason. All right. So, doctor. So we'll come to question time. I'll ask my questions, and I'm sure the viewers will also ask their own questions. So, my first question to you is that why do women put on weight after they have after they give birth to children? You know, usually before we get married, we're always as thin as a rake, and then once we start having children, we just begin to balloon, grow bigger and bigger. So what's the reason?
In pregnancy, every woman will put on weight. One, fluid retention. You've also got the baby there. You've got more fat, and all pregnant women tend to put on weight. How do you get that weight after pregnancy? Depends on lifestyle choices.
Okay.
Ideally, after childbirth, one should undertake exercises. Easier for me to say, but that's the advice that one should do. It is also said that breastfeeding does help weight reduction. I'm not sure. The World Health Organization is currently promoting women to breastfeed rather than taking the artificial milk. So again, that might help. And again, don't forget that as a new mother, you're not as active as you would want to be.
Yeah.
You're probably sitting down, feeding the baby most of the time. And because you're not exercising perhaps as you used to be,
Yeah.
people are on maternity leave, they're not going out as often as they used to, then you don't lose the weight. Dietary aspect is a different thing. If you eat more than you should be eating or the wrong food, then you will still have your weight on. But when you look at people who take it seriously, I think it's one of these singers, I forgot, Beyonce, uh,
Okay.
and one of Posh, I can't remember the names, I've forgotten them, it's just my age. After they had their baby, I'm sure they went into a routine of exercise and diet, and they got back into shape. So it requires discipline. Easier
Hmm.
said than done. I am trying, even though I'm not a woman, now I'm trying to lose weight as well. And I know how difficult it can be.
I know. I know it's really really very tough because um, after childbirth, we stay up at odd hours trying to look after the baby and attending to the needs of the baby, and so getting up in the morning to go and exercise becomes a very difficult thing to do. So, and in the process, the weight kind of adds on. Thanks,
That's
doctor.
correct.
And then also another question I have for you is that also the sometimes our shoe size, because it happened to me. I was a size 39 before I started having children. But after having children, I mean after my first pregnancy, my shoe size increased by one. So I'm now a size 40. I've been a size 40 since then. So what is the reason for that too as well, Doctor? Prof.
Yeah,
Sorry.
I think it's also related to the weight retention, the weight gain that you do not shed after pregnancy.
Okay.
And in addition to that, You know, I said there's fluid retention during pregnancy. So naturally, your legs will be bigger in terms of swollen, and you may need to wear a size higher than what you used to wear to make it more comfortable. And again, don't forget that when women are breastfeeding, some people sit down with their legs on the carpet or the floor. That doesn't aid fluid return back to the body. So you tend to have swelling of your feet. Perhaps what women should do, if you're breastfeeding either in bed, then you're lying down, that's good. Or if you're sitting down, put your legs on a poof, raise your legs, and that will aid fluid return back to the body. And in doing so, the swelling might go down.
Okay. So what about the voice?
The voice. What's wrong with the voice?
It's now, it sounds older, you know. It's like, you know, when boys are, you know, boys,
Puberty.
yes, yeah, when they reach puberty and their voices break and they begin to sound like men. Also women too, you know, when they start having children, their voices just kind of become deeper, heavier.
Yes, I think I can agree with you, but it's not something very common that people will notice because it has to do with the pitch and perhaps the octave, and it may not be very clear to people listening to you that your voice has gone deeper. But there are studies that have been done that have confirmed that, yes, women's voices after pregnancy can get deeper. And I think it's due to the hormones. We're not sure exactly why, but in pregnancy, you've got a lot of estrogen, progesterone in the system, and even testosterone. And perhaps that is why some women have deeper voices. Again, just to reiterate to confirm what you've said, Adele, who is a singer, I think
Yes.
she's been away for a while. She's had children, and she's come back with a new album. And I think most of the comments people said is, oh, Adele's voice is still good, but it is deeper. So that's why pregnancy probably has an effect. But I think most people don't recognize it because the difference is not that big. You wouldn't be talking like a man if you have a baby.
It's amazing what happens to women when once they start having children. And you know, it is also said that once a woman is opened up, that things are no longer the same with her body. She now begins to have all sorts of ailments, you know, just because her body has been opened. How far is that true, doctor?
I think I know what you're talking about. I could look at it in different ways. In pregnancy, there are women who develop diabetes. That is, pregnancy brings out diabetes in them. They must have had the potential to develop diabetes. And in pregnancy, it precipitates diabetes. That's gestational diabetes. And if you do have that, you are looked after in pregnancy by the midwives and obstetricians, either with diet or with medication. And we do advise that after you've had your baby, this is where the dietary control comes into the place. Yeah. So if you've developed diabetes in pregnancy, there's a higher risk that you will develop diabetes eventually. And this is where weight reduction, keeping your weight down, eating the appropriate food does come into play. The other disease that one could think of is high blood pressure, hypertension. For reasons, women develop what we call pregnancy-induced hypertension, high blood pressure, which will control during pregnancy. And again, after pregnancy, we keep an eye on it in the early few months. But as the years go by, one should be careful that it might rear its head again because you've had it before. Yes. And so that's talking about the medical aspect about when you said opening of the body. But perhaps looking at it again, what some women complain about is the intimate part of the body. I think it's 3 o'clock, and children might be watching, so I'm going to be mindful of the words I use at this stage. But I'm sure the adults listening will understand what we're talking about. Yeah. Now, you can imagine the shoulder of a baby, how long the shoulder of a baby is, the size of the head. Now, if you have a normal delivery, the baby has to come through that area, the private part. Yes. And it stretches the muscles. Sure. And yes, it does stretch the muscles so that the baby can come out. And because it stretches the muscles never go back to what they were before. And this is where pelvic floor exercises after childbirth is very, very important. If you do your pelvic floor exercises, you try and increase the tone and tense out strength of the muscles. And I usually tell people it's a lifetime thing you have to do. It's not something you do for 3 months or for 1 week. No. And there are simple exercises. It's more of tightening the muscles around that area. If you want, you may visit a physiotherapist who will tell you or teach you what pelvic floor exercises to undertake. But it never, unfortunately, it never goes back to what it used to be. But it's not as bad as people say. It's not a gaping hole. No, you will not have a gaping hole there. So that opening up, no, yes, there are changes, but they are natural changes.
Wow. So Prof, why do doctors always advise to have your baby through natural means and not through cesarean section?
Well, you've said it, natural means. So we are designed to have babies naturally, but there come a time when cesarean section is required. Cesarean section means opening up the body, taking out the baby. It's an operation. It's a big operation, and people can become infected after an operation. While operating, we can damage the bowel, the ureters, organs in the abdomen. People are prone to developing clots. Again, people can die from cesarean section. So unless it is absolutely necessary, it's better to go down the path of having a natural birth. That's the way God designed us. But God has also given us that wisdom that should there be any deviation from normal, should there be any abnormality during childbirth, then you can have a cesarean section. But opting for a cesarean section electively, as they say, to push, yeah, it has its risk. And again, in some countries, such as Brazil and in Eastern Europe, if I deliver your baby by cesarean section privately, I'm going to take money off you. But if you have a normal delivery, then my income is not going to be as high as that. So there are some doctors who, for the sake of income, encourage people to go down that path. But if it is not necessary, no, go down the natural path.
Wow, thank you, Doc. So I was going to ask one question, So when you open up a woman, you, Prof, when you're on the operating table and you are operating on a woman, what is going through your mind when you open the woman up and you see all the organs in the body? What are you thinking of when you are doing the operation? What goes on in your mind?
Safety. Oh, be careful. as a gynecologist obstetrician, you've got two lives. You've got the mother and you've got the baby. So when you're operating, even if you're not an obstetrician, when you open up anybody, you don't want to cause harm. If there's a disease process in there, then you want to operate on that area and make sure you do it properly. You want to ensure that you do not take out the wrong organ, because it's happened before where people are taken to theater to remove, say, the right kidney, which is the diseased one. And because we don't put in checks and balances, we take out the normal one. That's human error. So when I open up a person, I'm working with a team, and we have our checks, we have a discussion of what we want to do. And like I said, my prime concern is to make sure I keep that patient safe, make sure they don't bleed too much, make sure that I don't damage the bowel or the organs around that place. So just to summarize, it's making sure that we keep that patient safe.
Thank you, Prof. Thank you so much for that answer. So now let's come to menopause, Prof. What is this menopause? Because, you know, a lot of us in our 50s, I mean, some experience menopause quite early, maybe in their late 40s, some in their early 50s. But what is menopause all about, and why does it linger for so long? When it starts, why doesn't it stop?
Right. I'll try and tease that out a little bit. Menopause per se is said to have occurred if a woman hasn't had a period for 12 consecutive months. If you haven't had a period for 12 months, then we say that is the menopause. But in the years leading to the menopause, you may have a period that comes, then no period for 3 months, then it comes again, then you get the hot flushes, you get the night sweats. That's the climacteric symptoms, and that's the premenopausal phase. That is where you get all this vaginal dryness, forgetfulness, you can't sleep well, the hair falls, brittle skin, and that's the climacteric symptoms. And then you have the menopause. And some of the symptoms of the climacteric, the hot flushes, the night sweats, continue into the menopause and after the menopause. It is said that usually it should go away in about 2 to 3 years, but we're not all the same. And for some women don't even suffer the hot flushes and night sweats, whereas some people suffer it, have it badly. But usually it is said that after about 3 years, it should all go away. So it depends on the individual.
3 years.
Well, but there's
Mine is
hope. There's intervention.
past 3 years, Prof, and even some of my friends too. So many of us, you know, you see us with our fans. I have my fan here, Prof.
Yeah. Well,
Sometimes.
I know of people who carry their fans even into their 70s. I've seen 70, late 70. It's the absence of estrogen or the low estrogen levels after the menopause. The ovaries are not producing that hormone that normally would have prevented all these symptoms. And if it's affecting the quality of life, that is where people now talk about hormone replacement therapy, so that it reduces the symptoms. There's a place for hormone replacement therapy, either the orthodox way, or some people go the herbal way, and some people swear by it.
The herbal way. What's the herbal way?
When I use the word herbal, I'm talking of phytoestrogens. These are plants that contain estrogens, lentils, soya milk, and a variety, mainly vegetables. Yam, for example, contains phytoestrogens. How effective they are in controlling hot flushes and night sweats is a different story. As human beings, we're all different. The severity of our symptoms differ. So if you have mild symptoms, perhaps the lentils and the other phytoestrogens will help. But if it doesn't help, if you've tried that and your quality of life is such that, I mean, it's really affected, then that's when you seek medical help. And like we said, there's hormone replacement therapy. There's a lot of information out there. There's also a lot of misinformation out there. Low dose estrogen, what we're trying to do, we say hormone replacement therapy. So we're trying to replace what the body would normally or was normally given you. So we've come to the realization that if you use low dose estrogen to tide you over that period, maybe for 5 years, then it reduces the hot flushes, the night sweats, the irritability, and the vaginal dryness, amongst other things. I think the scare is the risk of breast cancer.
Yes.
And that is where we take a good history, a family history. If there's a strong family history of breast cancer, again, this is up for discussion. You have people, I don't want to go into breast cancer. I will concentrate on hormone replacement therapy. And I can read something that says, explain all the ways of hormone replacement therapy. Now, the two hormones are the estrogens as well as the progestogens. Now, it's the estrogen that helps with the hot flushes and night sweats. But estrogen also stimulates the lining of the womb. That's why people have periods. So if you got to the menopause and you want hormone replacement therapy, then you've got to take the combined one, the one that contains estrogen and progesterone. The progesterone aspect of it protects the lining of the womb so that some women don't get endometrial cancer. However, if the woman, for example, has had a hysterectomy for whatever reason, fibroids or prolapse, then you can give such a woman, if they want replacement therapy, just the estrogen component, or ERT, estrogen replacement therapy.
Wow. Thanks, Prof. Thank you for that explanation.
You're welcome.
So many things that that we're learning today. So is there any particular diet to kind of stop this, apart from all these things that you've mentioned, is there any particular diet that one can, take to stop or to reduce the effect of menopause, of, the menopause symptoms, the hot flushes, yes,
and the night sweats. Yeah, I will reiterate it again. That, I mean, in hormone replacement therapy, we're given estrogens. Some of the orthodox medication we use come from plants. They're manufactured from plants. But how much lentils will you eat to give you the amount of estrogen you need? I think that is one of the issues, is
Doctor, we can't hear you again. Prof, we can't hear you again.
Was there a break in transmission?
Yes, there was a break in transmission. We couldn't hear you for a few seconds.
Yeah, sorry. Yes, there was a call that came in, which I declined. I think that's one of the issues we have with technology.
Yes.
But I declined the call. I'll take it later on. So yes, what I was saying was that how much lentils and plant-based food will you eat, soya milk will you drink, to give you enough estrogens to combat the hot flushes? Again, difficult to quantify. And that's why I initially said, once you've tried the estrogens or plant-based or dietary control, if it doesn't work, if you can cope with what symptoms you have, fair enough. But if you're waking up at night, if your bed linen is soaked because you're sweating, your quality of life is bad, then you need help. And I think it's science has gone to, every day there's new information coming, and there are newer products coming. And what we try to do is to ensure that we use very low dose estrogen so that we don't cause or increase the risk of breast cancer.
Okay. So thank you, Prof, for that information. So should women douche or even wash with soap? Because there's a lot of controversy about disrupting the pH level and soap causing cancer. Is this true?
Causing cancer, I will say no, it's not true. Douching will not cause cancer. Douching, I believe, is common. French women do a lot of it, and I don't think it has increased the incidence of cancer in French women. It's not common in the UK. Some women do it, some women don't do it. But what people say is the vagina is self-cleansing. So why do you want to douche with soap or with some chemicals? I'm happy for people to use just water. If you want to use water, that's fine. But by the time you're using things that contain chemicals, then like you rightly said, it can alter the pH, the acidity or alkalinity of that area. And that's when people get abnormal discharge, they're prone to thrush and stuff like that. Why do you want to douche? I mean, I look at it from a practical point of view. If that area is a dirty area, then God wouldn't have allowed babies to come through that place. When babies come through the vagina, their eyes, their nose, their mouth goes through that area. And they don't come out infected or carrying out any infection unless the woman already has a pre-existing infection. And we could go into reproductive health, we could go into sexual health. If you have one partner and you don't have chlamydia, you don't have gonorrhea, you don't have thrush, then why do you want to douche? But if you have multiple partners, for whatever reason, that's a different story. So there's a place for douching. The French women, and I'm sure other cultures do it, but it's not something that is widely recommended in the United Kingdom.
Oh, wow. Thank you, Prof. So, Prof, why do women have painful periods? Young girls and women, why do they have painful periods?
Because they're women. Well, I mean, this is what happens. I'm a man, so I can't tell you exactly, but this is what happens, jokes apart.
Okay.
During the menstruation, when people have periods, you have prostaglandin release. These cause some contractions. Contractions.
What does whatever release?
They are chemicals released by the uterus, by the womb.
Okay.
And they cause contractions as well, and that can result in pain. But I think more importantly, people who have heavy periods, you can imagine some people will describe them like liver, a lump, a clot. And this large clot wants to come out through a very tiny hole, the neck of the womb, the cervix. So to be able to come out, it dilates the cervix to whatever extent. That dilatation also causes pain. So it's the heavy bleeding, the dilatation of the birth canal due to blood clots that does cause the pain that women have during menstruation.
Hmm. Hmm. Thanks, Prof. So what about fibroids? Fibroids.
Fibroids. What about
Yes.
fibroids? That's could take us the whole day, but I'll explain briefly what fibroids are, because it is common in the Black community. Black people, white people have it as well, but we Black people also have it, and perhaps even more. And again, it can be genetic. It can run in families. But the starting question is, what are fibroids? Now, these are simple growths within the muscle of the womb. Why they grow, we don't exactly know. There might be some genetic component to it, but it grows within the muscle of the womb, and they can be as small as the head of a pin, or as big as a tennis ball, or even bigger than that. And when it occurs, some women have fibroids, they don't know they have it because they're small. But some people have fibroids that are big, and then they go to the toilet. Often they find it difficult to open their bowels, or people tell them that, oh, congratulations, or are you pregnant, or you look pregnant. And that's because of the fibroids. And again, the fibroids can present with heavy periods. That's the commonest presentation. Oh, I'm bleeding heavily. And when they're examined, they find out that they've got fibroids present. It can, in some people, it can result in difficulty falling pregnant. That depends on where the fibroids are. But like I said, talking about fibroids
Yeah.
could be a 1 hour session. But just to
So, Prof, if I invite you back, will you come
oh,
to talk
most
about
definitely,
fibroids?
most definitely.
Thank you. Thank you.
You're
Thank you.
welcome.
Thank you. All right. So I'll hold it to your word, Prof. Thank you so much. So now the next question is, some women have vaginal pimples. What is the cause of this, and how can it be treated?
Um, I think perhaps what you've used is a layperson term,
Yes,
and
yes,
I think my understanding is, yeah, what looks like pimples around that area.
yes,
Um, for whatever reason, the way we've all been designed, men and women, at puberty, we start growing hair around that area. I'm sure that is there for a purpose. In women, some people believe it conveys or confers some protection against infection getting into the vagina. But we are now in 2021. It's a liberal world. We want to wear thongs, we want to wear bikinis, and people shave. And when you shave that area, if you don't use the appropriate blade, or if you use dirty blade, or you don't keep that area clean, then you can develop what you've called as pimples. Maybe in medical terms, we'll call it folliculitis. So it's infection of the hair roots. And
okay,
that's why people should be very careful. I'm not saying don't shave, but if you do, get the right equipment. There are lots of them being sold now. Uh, Probably avoid using the razor blade,
yes,
because they are sharp and maybe not well made for that kind of area. And keep hygiene. I must talk about that. People want to look sexy, feel sexy, and they want to wear this nylon silky underwear. It doesn't allow the skin to breathe. So even if you're going to wear something, we advise that you wear 100% cotton, because that allows your skin to breathe.
To breathe,
If you wear nylon or silk all the time, then you sweat, then you've got bacteria there, then you get infection, and then you get the vaginal pimples. I hope that explains it.
Yes, it does. It does. All right, doctor. So what's the importance of cervical smear test? Cervical smear test.
Right, cervical smear test. Very important topic, which now we do know the cervix is the neck of the womb, and women get cancer. And over the years, previously we didn't know why women got cancer. But eventually with science, we found out that it's due to a virus transmitted sexually, the HPV virus, human papilloma virus. Now, you don't just get cancer. It starts with a mild illness or mild disorder, what we call mild changes in the cervix. And it could take years for it, if nothing is done, for it to grow into being cancerous. So when you do smear tests, and people are called for smear tests from the age of 25, and it's a fairly simple procedure. What we are looking for are abnormal cells, mild abnormal cells. We've even gone to the stage now where we do liquid-based tests. We take the smear and we can see whether the person has got the virus. So depending on that, you may need treatment, local treatment. And when you get local treatment, then it doesn't progress to cervical cancer. So with the introduction of a national screening test for cervical cancer, it has brought down the number of women,
yes,
especially in the Western world, that have cervical cancer. And I know that this audience is not limited to the Western world. We in the low resource or low income to medium income countries should also be pushing for a national screening service for cervical cancer. Cervical cancer is preventable. And if it's preventable, our governments should put such programs in place.
Thank you very much, Prof. So let me run through the commentaries, and because there are one or two questions here. First of all, let's say hello to everyone. Hello, everyone. Thank you for joining. Lady Wynette Peters, Mayville Prep Onyekon, thank you for joining. Kenny Diva, Ijoma, Patricia, thank you for joining. Auntie Olu, Cisse Yosman, Tony Benje, BB Fab, Azu Quadri, Ihuama, Plan B, Ifi, Lady Oyino, Maki, Dr. Ajala, Tony, thank you. Thank you all for joining. God bless you all for tuning in. So, Doc, so there's a question here, and it says, is Prof able to shed more light, if aware, on this new online system to see GPs nowadays and A&E being bombarded nowadays?
Well, that's the effect of COVID. It's got its positive aspects and it's got its negative aspect. With COVID, because it's been transmitted from human beings to human beings, that's why people have limited going into CGPs because you don't want to spread. We're in a pandemic and we are still in the pandemic. And we found out that there are a number of things we can do remotely. Previously, I would have had to come to your studio, sit down with you, have coffee with you having this discussion. But now
Yes.
we're doing it virtually.
Yes.
And for certain conditions, it can be done virtually over the telephone with GPs. So it's not that GPs are being lazy or don't want to see patients, but I think transformation has come. People resist change. And if there is the actual need to be seen physically, once you get talking to your GP, you tell them your symptoms. If they think you need to come in and see them, they will do so. If they think you need to go to the hospital, if, for example, you pick up the phone and say, I've got chest pain, nobody's going to ask you to sit down at home and let's have a virtual consultation. With chest pain, they're going to ask you, get the ambulance to get you to the hospital. So that's the new way of doing things. And it's going to change over the coming years. And some patients love it. You don't have to drive. You don't have to take 2 or 3 buses. You don't have to look for a car park in the hospital. You sit in the comfort of your home and you're talking to your GP. And again, where this is also important for low resource countries, is that you could be in my village in Ijabu. Well, my Ijabu is not a village, it's a town. And you could telephone me and talk to me over the phone or audio visual, tell me your symptoms, and I can point you in the right direction. So it's here to stay, and it will get better. There's something called continuous improvement. Areas that we think we need to tweak, we ask patients what they want, what they prefer, and we take all of that on board in designing the system.
Oh, thanks, Prof. So, Prof, COVID-19.
Yeah.
Now, people have had their 2 vaccinations, and there's talk about the booster jab. But now, people that have taken the 2 vaccinations, there have been some deaths that have been recorded. I mean, they contract COVID, and not too many, just a few, and they die. Especially in Nigeria, we've had cases of the elderly dying, even though they've been vaccinated twice. So, what is the reason, if you know, Prof?
Well, I mean, vaccination does not, it confers immunity, okay? It doesn't say that you're not going to die. When you're vaccinated, it just means that should you come in contact with the virus, your body already recognizes it and mounts a defense against it. Now, you spoke about the elderly. Now, if you have an elderly person who's got diabetes, poorly controlled, or who's got very bad chest, chronic respiratory diseases, should they contract the virus, their immunity or their state of health may not be optimum to be able to allow them to fight off the virus. So it's not that, oh, if you have, and that's why we still advise people, wear your mask, especially in large gatherings, social distancing in large gatherings, hand hygiene in normally. So the vaccines are very useful. It's reduced the number of people dying tremendously. It has reduced the number of people being admitted into hospital. And those who get the infection, they recover from it. But the elderly, people with underlying diseases, can die if they contract the disease. Just to simplify it, another way people put it is this: the seatbelt you wear when you're in a car protects life. We know that, it's been shown. But there are still some accidents in which you have your seatbelt on that people still die after a car accident. So the vaccines, I recommend it. It's effective, it's useful. what I usually tell people is read about it. Make sure you don't listen to disinformation. And I mean, you can imagine where we were a year ago. Everybody
Yes.
was panicky. We were on
Yeah.
lockdown, but things are
Yes.
getting better. I'm
Yeah.
talking about the booster dose.
Yeah.
What has been shown is that over the years, or I mean over the months, your levels of antibodies go down, it reduces. So what people are saying is have another one. I mean, if you look at the flu vaccine, you get it every year. Why do we get it every year? Because our immunity may have waned. There are new strains. The yellow fever, I think it's every 10 years that we get it, yellow fever vaccines. So booster doses are not new things. And if you're called for it, more so if you're classified as being vulnerable, then I would advise that you go for it. I'm talking about death. Most of the cases that have been reported, they haven't proven a direct link between the vaccine and death. It's just like saying, if I go shopping and I come out of Tesco and get knocked down, oh, that was because I went to Tesco that I was knocked down. No, I was knocked down because of the car or because I was texting while driving or whatever. So I think if you look at the number of people who've been vaccinated, I think they're into, I don't know the figures now, but millions, if not billions. And how many people have died? Very few.
Yeah, very few.
So you've got to weigh the advantages of vaccination
Yes.
over the potential risk of death.
Yes. Thanks, Doc. So do we have any questions? The audience, do we have any questions? The viewers, do we have any questions for Prof? So Prof, before the questions start rolling in, how do you relax?
How do I relax? Music is something I like. So I listen to a lot of music, different genre. I love people, so I talk to a lot of people. Along the young ones, we have a banter. I'm not very sporty, but I told you that's my next point. And I do take my holidays as well. I take my holidays, and I sleep. And I love a holiday, but we've been under lockdown now for 2 years. When I say lockdown, we've been restricted in how we can travel. But yes, music is the main thing for me.
So what type of music do you like to listen to?
Anything and everything. Jerusalem, rhythm, R&B, Spanish music, soca music, reggae, Nigerian music. We are doing very well globally now. Classical music. It depends on my mood or what mood I want to be in.
So do you play music while you're doing operations? Because I know some doctors, play some form of, soothing music while they're operating on patients.
Yes, I do. When I was very, very active as a surgeon, I had my collection that I would take to theater and put in the background. But we've got to be very careful that it's not too loud. It doesn't distract the team, because if it's too loud, then this is where human factor issues, situational awareness comes into being. But music in the background, soft music, if that's what the surgeon wants and it helps him maybe concentrate or relax or feel relaxed, there's nothing against having music in the theater. What I wouldn't listen to is the head banging techno kind of music.
True. Prof, you know how to dance. I saw you on Dr. Adala's her daughter's birthday or graduation. on her Instagram page. I saw you dancing. Do you remember that post where you were dancing?
I do.
You can dance. I mean, for a
Well,
business-minded person, you can. You're a
well,
stepper. Yeah. So
well,
I
well.
think that's one of your hobbies too.
Yeah, I love dancing.
Yes.
I wouldn't deny that. Good
Yes.
music, I'll get up and dance. I
Yes.
think no. Tony, if she's online, saw me last night. I did a few dance steps. Again,
Okay.
it's good. Again, it's good for exercise. We were talking about weight reduction.
Yes.
Now, rather than going hiking or running 10 miles, if I were to undertake my own weight reduction, it's through music. I put on music and I dance. It may not be good to the side. I run around, just shake my body, and it's very effective.
Yes.
It's like doing Zumba classes. When you do Zumba classes, it's music in the background. You're dancing to music, moving all your muscles and stuff like that. So that is I love music and I love dancing, but
There-
my body now doesn't allow me to do the moves.
there's a comment here from Lady Oino. She says Prof Jaiyesimi is an all-rounder. He's a vibe and more. Yeah. So, Prof, I was going to also ask that: do you pray before you undertake operations? Do you pray? Do you pray to God?
I do. I'll be honest with you, not always. I pray in the morning before leaving. At times I pray in the car while driving to work. But definitely, if I have a patient lying on the table and I see, people have tattoos now, and I see a tattoo that's got the devil on it, on the skin, then I do pray internally that God take control here. Why people will put a tattoo of the devil on their skin? It's personal. Why it's there, I don't know. But the simplest operation, the operation you think, oh, this is just going to be easy peasy. At times you get in there and you struggle. And I think one should commit our ways in everything we do to God, irrespective of what faith you are. Commit your ways to God. Commit things to God. When patients phone me and tell me they're going to theater, I ask them to pray that God should give the doctors and the nurses that's going to look after them the wisdom to do the right thing. So I believe in prayers as being effective. Healing, I believe in prayers, and healing comes in all sorts of forms. It may be contentment or acceptance of the condition you have. But again, we could go into faith and healing on another topical journey.
But have you seen miracles? Have you
Oh,
seen
yes.
miracles while on the operating table? Have you seen miracles, near-death situations, and then a miracle just occurs and the person comes back to life? Have you seen such?
I wouldn't say on the operating table. I think that's the miracle will be the doctors doing the right thing that they have to do. There are patients who've had cardiac arrest on the operating table, and the doctors and the nurses do what they have to do, and they bring the patient back to life. If you want to call that a miracle, yes, that's a miracle. But I've seen miracles of where, as a gynecologist, you think you've done all your tests, and you think this woman will never, never be pregnant. And I remember a patient who told me, a patient of mine, who told me, I mean, by what I could see in front of me, there was no way she was going to get pregnant. And she shared this experience with me. She went to a church, and during the service, the pastor said, there's somebody here who has issues with having babies. Come forward. But everybody's shy. She couldn't go forward. At the end of the service, she went to the pastor and said, it is me. The pastor prayed for her, And she said immediately she felt something in her tummy. She came to see me, told me she was pregnant. We hadn't done a pregnancy test. It was too early. She told me it was going to be a boy and it was going to be Isaac. And I said, can I write this in your case note, coded? And she said, yeah. But the next time she came, she was pregnant. So I believe miracles do occur. Yeah.
Okay. All right. Prof, there's a question that just came in. It says spotting in menopause. What does it indicate? And what should women do?
Spotting in menopause, I think they're referring to bleeding.
Yes.
Anybody who hasn't had a period for 12 consecutive months, who bleeds, whether it's a tiny speck of blood, you must, and I use the word must, see your GP. It could be something that's just simple, but it could be cancer. Most often, women who bleed after the menopause, when you examine them, you tend not to find anything serious, but at times you find cancerous cells. And the reason or why we advocate presenting early is even if it's cancer and we get it early or earlier, then you get treated early, then the outcome is usually better. The survival rate is higher. So any woman who bleeds after the menopause should please see their doctor. I mean, spotting, I'm not saying, oh, the very tiny little blood you see, or run off to your GP. If it's persistent, say for a week, then you must see your doctor. It's better to be safe than sorry.
Sorry. Oh. Thanks, Prof. So what are the general checks a woman should do for good gynae health?
For gynae health, we'll start with the breast mammograms. I think from the age of 50 or even before the age of 50, women should undertake self-breast examination, looking for lumps. That's a possibility. The cervical screening test is a possibility. Your pap smear from the age of 25. Basically, those are the female screening tests that we offer. The general ones are the blood pressure and stuff like that.
Yes. Thanks, Prof. So what are your final words to all of us that have been on this program and those that would also watch later? What are your final words?
First of all, is to thank them for tuning in on a Sunday afternoon. They could have spent the time lying in bed, but thank you for tuning in. My final words is that, or my final statement is, health is wealth. Let us look after our body. Let us be careful of what we eat in terms of our dietary, what the type of food we take, how much we take. Let us exercise. Let us sleep well. We now talk about mental wellness or mental. Do things that that will make you relax. Worry less. Yeah, there are lots of stressors in life. You have to find a way to cope with these things by talking to people, friends, family, physicians, nurses. But my final word is look after your health. If you can look after your car by doing your regular checks on your car, even in low resource countries, you check the tire before you go on a journey. You check your engine oil, the pressures in your tire, not to talk of the human body. Replacing the parts in the human body is very difficult. Organ transplant is not easy to come back. You can change the tire of your car. It's difficult to change a kidney. So my plea is any deviation from normal, any deviation from normal that's lingering 2 weeks, 4 weeks, please seek help.
Oh.
And there's a place for second opinion, because you go to your doctor and you say, I've got this problem, and they just say, oh, it's this, it's that, go away. But the problem hasn't gone away. If you're not happy, seek a second opinion. Stay healthy. In this time of COVID, please stay safe. And to people who haven't been vaccinated, talk to them, explain to them why it's important, and let's all keep safe. Thank you.
Thank you very much, Prof,
You're
for your
welcome.
time, for educating us on health matters concerning women. God bless you, Prof.
Yep.
And I'm very, very happy that you agreed to be interviewed. And to my listeners and viewers, thank you for listening and tuning in. God bless you all for finding time on a Sunday to join me and Prof. So thank you all. God bless you, Prof. Like you promised, you'll come back to talk to us about fibroids.
Definitely. So, thank you for having me. Thank you.
Thank you, Prof. All right. Take care, everyone, and have a wonderful Sunday and a lovely week ahead. Bye, and God bless. Bye-bye.
Bye-bye.
Thanks, Prof.
Thank you.